Good afternoon, guys. I hope we're all sparkly. It's the end of another very busy day at the Men's Health Clinic. And I thought I'd do a video on what it feels like to have low testosterone. You can read the textbooks and say low mood, anxiety, fatigue, brain fog, low libido. What does that equate to really? Is it lack of drive, lack of self-esteem, low confidence? Yeah. But what does it really mean? It means you're running on empty. That feeling that you are existing and not living. And that's not a comfortable feeling. Now, you can place a frog into a bowl of cold water and heat it up, and the frog will not get out. It will boil to death. That's like low testosterone, because the changes that you feel are often insidious in nature. You wake up, you feel unmotivated, you feel no joy, the day goes on and the day ends, and that's it. You can try to get out of this mire. You can try exercising. You can try ice baths. You can try mindfulness. You can try getting good sleep. But when you've got pathological low testosterone, you won't see the reward for your effort. And we talk about earning your reward all the time at the Men's Health Clinic. But you need that foundation. You need that testosterone to give you the ability to see the reward for your efforts. So when I talk to my new patients, they say, I tried that, tried this, didn't work. And I say, well, okay, you were fighting a losing battle. The guys with morbid obesity, I tried losing weight and it didn't work. Okay, but you didn't have the foundation. You didn't realize that actually, if you have a severe caloric deficit, your SHBG is going to go up, which with normal testosterone is actually quite good because it's a positive health marker. But with low testosterone, it's going to decrease your free testosterone even more. Your thyroid is going to become less active. You're going to become in a more hypometabolic state. Confusion. Your physiology does not like dramatic change. When we change things, they should be slow and progressive and incremental. You don't go from a couch to running an ultra marathon. Nobody's that stupid. So the same thing happens with physiology. Your physiology does not like change. Paradoxically, it would prefer to be underactive than erratic, which is the reason why lots of people don't feel wonderful on TRT, because they have troublesome peaks and troughs, and your physiology doesn't know what to do with that. So when we talk about consciousness being the subjective appreciation of change in your physiology, we're not joking. Because let's take tadalafil as an example. Tadalafil is a wonderful drug. It's obviously for this. It's also for your cardiovascular health. It helps maintain the endothelial lining of the blood vessels. It helps with blood pressure. It helps with prostate health. And it primarily does that because of the release of nitric oxide. Now, I quite like a daily tadalafil as a preventative thing and a mild aromatase inhibitor, because lots of people present with slightly high estrogen compared to testosterone on therapy, and they don't need an aromatase inhibitor, but they need something to help modulate their estrogen to bring that testosterone to estrogen ratio back to perfection. Now, of course, look to modulate what? Yeah, stress, sleep, nutrition, exercise. Look to additional supplementation like zinc, calcium D-glucarate, DIM. Reverse the liver dysregulation that has happened over 10, 15 years. How can you do that in 2 months? Well, you can't do that in 2 months. So again, you need to make these changes. They need to be sustainable, and you need regular review to readdress your protocol to less is more. However, as you guys know, we're massive advocates of microdosing, daily test SIP and HCG. That is less, that is not more. I don't believe testosterone monotherapy is an effective therapy compared to testosterone and HCG, because testosterone monotherapy will suppress the release of LH and FSH from the pituitary gland. And it's not just about testicular size and function and fertility. It's also about the positive neuroendocrine effects that HCG has. So you will hopefully feel a sense of libido and sense of well-being that you won't feel on testosterone monotherapy. We like the concept of TRT to be HRT, hormone replacement therapy. So yeah, it's super important to understand your basic physiology. And when you're running on empty, that's difficult because you can't see the wood for the trees. You don't see any reward for your effort. So when you go on therapy, you can now put the effort in and see the reward. You won't have that irritability that's been bugging you. Because again, let's go back to the sympathetic nervous system, parasympathetic nervous system, and then the foundation hormones. When you've got low testosterone, rather than being proactive, you're reactive. So you're using your nervous system to compensate for not having adequate hormone levels. So lots of people complain of being irritable and not having that sense of calm. So when I review patients in clinic, invariably they say, I feel a lot better than I did pre-TRT. I am coping with life's exogenous stressors better than I would have done. I'm less reactive. I'm more calm. I'm more considered in my reactions. And you know who's told me that? More often than not, it's their partners. Because your subjective appreciation of your current state isn't always wonderful. It can be if you do practice self-reflection. Not many guys practice self-reflection. But what we do need to do now is implement those things that didn't necessarily work first time, but now with the foundations will work. Stress reduction, sleep hygiene, avoiding booze, eating a proper well-balanced diet, practicing intermittent fasting. I love intermittent fasting. I'm practicing OMAD at the moment, 1 meal a day, and I'm loving it. I'm loving the extra alertness and energy that I've got during the day to concentrate on the task at hand. And I'm enjoying my 1 meal a day. You have to understand that we follow a diurnal pattern when it comes to testosterone. Your anabolic processes predominate at nighttime and your catabolic processes predominate in the daytime. They're not mutually exclusive. You are slightly anabolic at nighttime, in the daytime, and slightly catabolic in the nighttime, because you need to have the capacity to react, much like obstructive sleep apnea. You know, that essentially is a catabolic state. That is your brain and nervous system recognizing that your oxygen saturations are dropping, so you need to wake up. So you don't just switch off these things. They are working, but they're more predominant at certain times of the day. We can further split the day into the first part of the day, which is more sympathetic and catabolic, and the second part of the day is more parasympathetic and anabolic, to then go into nighttime to get good quality sleep. Lots of patients go, well, I wear myself out till I collapse. Well, that's actually not good, because the quality of sleep that you're going to get is not going to be great, because you're not going to have sufficient REM sleep, because you're going to go straight into deep sleep. And there are 4 cycles to sleep, and we want them to work effectively. So let's go back to the morning. You have this spike of testosterone and cortisol. Why? To get you out of bed, to get you motivated and driven to do what? Yeah, go earn your reward. So what does that really mean? Let's go back to hunter-gatherer days, because that's where we came from. So you're supposed to be active to go hunt, to attain the reward, which is food, which then starts the parasympathetic nervous system, calm, rest, to then move into sleep, and then the cycle continues. Active, rest, sleep. Active, rest, sleep. So you should plan your day and try and manipulate your day to your normal physiology. And then you will see the what? The reward for your effort. So, low testosterone, running on empty, normal testosterone, go earn your reward.